We're now approaching the west end, the employee entrance, so to speak. On our right, we'll start with the oxygen. The micro bulk tank means we don't need to keep a lot in stock. Room next to that is laundry, much larger than our current facility, and then deep in the corner you'll see the riser room. Should give us plenty of room. Moving on to the room next door, we have central storage. Then you can see the door frames already in place for surgery. This is surgery west or surgery 2. This is surgery 1 or surgery east. And then moving back into pack and prep. See, this is surgery 1 on our left. And then surgery 2. And we have the storage closet and the janitor's closet. Now that's surgery east. Move it into the hallway. Move down into the windows that are framed out here. They're where the runs are for treatment. It is kind of confusing trying to look through all these steel studs to appreciate. But you may notice with this door that there is no bottom track, just like with the surgery doors. They hang from above. We do have room for a couple more runs right next to these. And then we have ICU or treatment. We've got some walls right in the middle, which is where the treatment islands will go. This is where the tech station will be. Tech station is actually on the far side. So as we move through this large treatment room to the other end, all the cages will be where these windows are. Those windows are not real. And then on our left, we've got a few more runs. We want to make sure we've got enough space for large dogs. Obviously, these will have to be well-behaved dogs. Next to those runs, we have the doctor's fishbowl. So it's an office for, up to 8 doctors at one time. And right next to the doctor's office, we have the cat ward. Next to the cat ward, we have the phone booths. So these are small, sound-isolated rooms. There are 4 of them that will allow anybody that needs to use the phone, whether it's technicians or doctors, to do discharges or patient updates or just talk to clients. Now we've moved next to that, sorry for the jump there, onto the sidewalk in this nice, large indoor relief area for our dogs. And you can see that through there we have the cleaning room. We're walking back alongside this large room, this large relief room here on our right. And then ahead of us will be the Chief of Staff office. Next to that is an administrative office. The storeroom, the IT closet, and then the room that is storage or cleaning for that relief area, because those junction boxes are in a way it's kind of hard to see. Looking out the eastern end, so we'll start on the north half. This is the stray ward. A couple of runs and some cages. Next to that will be the ward for staff pets. Again, a couple of runs and some cages. Next to the ladder here, we're going to see hard U-turn. This is the extern's call room or the extern's bedroom and office. They'll have a small desk and a bed in there. Then we have their shower facility. and next to that their bathroom. Now next to their bathroom in the hall, we have a janitor's closet. Lovely place to put a couple of drinking fountains because ADA says we have to have them. And then next to that is the conference room restroom. And then the conference room. This room has turned out to be bigger than I thought once the walls were up. This will be good for small groups to meet, whether it is grief loss support or whether it is teams of our staff that need to meet. We've got a place to do that. Going back down that same hallway, another hard U-turn. Sorry about this. And looking into the VSW office. Sliding down to the west, we've got the relief area. Oh, I'm sorry, that's the doctor's office on our left. And now we'll see the comfort room. So it's comfort room number 3, next to the hallway that goes into the conference room. And then comfort room number 2 and comfort room number 1. As you can see, they have their own exit so people don't have to go back through the lobby. Now on the left side, these are consult rooms. So there is 6, 7, actually, sorry, that was 8 and then 7. And then on our left there is number 6. Moving through this hall towards the lobby, we have consult number 5 with all the HVAC and the ladder. Over to our right now, we've got some client areas, some seating. We've got another janitor closet and a waiting room bathroom. Looking back, the reception desk will be right in front of this opening. This is the admin office for reception. On our left is consult room number 4. There's consult 3, 2, and 1. But we'll get to those through a different hallway. Here is the entry. Turning around, sorry if you're motion sick, going through the admin office. Looking into the treatment room from the technician station. There'll be treatment tables on the other side. Now this will be where most of pharmacy is. And this will be where most of our lab is. Walking past ICU and the runs on our left, we come to an alcove, a large alcove that is food prep. And then moving down the hallway close to food prep, we've got consults 3, 2, and the big one, which is number 1. Right next to exam 1, we have the mechanical room. This is CT, but we'll see that from a different angle in a minute. And next to CT is X-ray. Another hard turn around a corner, looking into X-ray or imaging. You can see CT beyond that. There's endoscopy. We'll get to that in a minute. Here's the cleaning room for the isolation relief area. And past that is mechanical. Now we're looking into CT. Turning 180 degrees. We'll go back and look a little bit more into endoscopy. Through endoscopy, you can see mostly isolation. There's a surgery room. All right, coming through the front of isolation, this is the isolation workroom. There is the South Isolation Ward, endoscopy, isolation relief area to walk those dogs, and the clean room is just past that. And then the North Isolation Ward. So staff bath across the hall. Moving into the staff locker room in the corner. And then looking through this doorway into what will be the staff lounge. A 270 turn here back to the left. Eventually going back down this hallway, we'll notice the staff bath is again, it's now on our right. And next to that is the morgue with room for 2 freezers. And that concludes your tour, at least for today.